Welcome to the Happy Doc, the voice of fulfilled physicians. This show is about bringing inspirational, creative, successful, and happy health professionals to you. Get ready to learn how you can be a happy doctor too. Hello, everyone. This is Dr. Taylor Brana, and this is another episode of the Happy Doc. I have to start this episode off by saying that Dr. Qaali Hussein is our most popular guest on the show. Her episode has the most downloads on our podcast. She has the most views on our YouTube channel. She's an amazing woman. Just to recap, she is a trauma surgeon. You have 5 children, that's correct?
6.
Six kids. My apologies. She has 6 children. That's how many it is. It's just so much. 6 kids. As a trauma surgeon, she went through multiple pregnancies during her residency. She's also a Muslim woman. She wears a hijab when she works. And obviously that has caused some issues with certain patients. And she's written articles about this, such as the one I'm looking on right now. It's called You're the Surgeon, that she wrote on Doximity, just as an example. But she is an amazing woman and an amazing surgeon, and it's an absolute pleasure to have you with us today. Thank you so much, Dr. Qaali Hussein, for being on the Happy Doc.
Thank you so much for having me back, Taylor.
Absolutely, absolutely. And for today, I wanted us to touch base because I wrote a little bit of an article as well as a podcast episode about the importance of time and how we really don't have a lot of time as physicians, as residents, as students. And it's such an important concept. And one of those concepts is work-life integration. And so, Dr. Qaali, I want you to hop in here because you probably have one of the most busy schedules as a physician. So let's talk first about how is your balance going into this whole process, and we'll kind of jump into the conversation of work-life integration from there.
Okay. Well, right now I have a pretty good balance. So I specifically chose, when I was job hunting, one of the things that I was looking for was something that would allow me to have a good amount of free time that I could spend with my family and taking care of my kids. And so right now it's pretty good, but I had to learn during residency the importance of managing my time, and that's actually one of the things that I have always wanted to talk about is during training, there's such, with all the negative stigma that's associated with pregnancy, getting pregnant and having kids was one of the things that actually taught me to manage my time. Okay. The thought is that, you have more responsibilities, something is going to have to go, you're going to neglect your patients, your studies, or your family. And when I started having kids, I managed my time better. I studied more. My, in training exams, my scores got better. The more kids I had, that exactly, it's shocking.
Interesting.
But that's what, nobody believes it when I tell them. But I had a study partner that I used to study with, throughout training, and we both noticed it, as we were studying and as we were, comparing scores and whatnot, that the more kids I had, the more I studied because I knew my time was limited.
Wow.
The more responsibilities I had, the better I managed my time.
Why do you think that is? I mean, that is just so counterintuitive to me. What was going on that made you focus more? What was it exactly? So,
and the reason was because, I've talked about it on the podcast before where, after I started having kids, it was, all the discouragements to say, this has never been done. It's not, it's never going to be done. You're going to have to go find something else. And, this was something that I absolutely had to do. And I had, nothing else would satisfy me. This was what I worked for a long time. Mm-hmm. And so in the back of my mind, the thought that I had was, if I, fail, or if I give up, or if I, move on to something else, then I would be a prime example of why women shouldn't have kids in residency, why women shouldn't pursue surgery.
Right.
And that thought, kept haunting me. So it encouraged me to study more and to manage my time better. And then, and just, basic things like, if I had waited to come home and study, I remember I tried to do that the first time I had my daughter, who's my oldest. She tore my book. I still have my textbook with a page torn out. And so I figured from that, experience that everything that needed to be done regarding my work and my studies had to be done before I got home.
Yeah.
So that when I'm home, my time is devoted to my family.
Yeah, I love that. And I think, there's a few things you said there that was so interesting. But the first thing that really popped out to me is, you having children and going through the pregnancies during residency and your training. It's interesting that actually, was a motivational factor. You're like, I'm not going to stand down. I'm not going to be weak. I'm not going to lose out on this opportunity. I'm going to work harder. It was a driver for you, which I think is so impressive and definitely speaks volumes about who you are as a person. And then the other thing you said at the tail end, which is something I actually heard from a couple of other guests as well, is you kept all of your work at work because you started to realize that if you took it home, it wasn't going to work out for you. You have kids at home, you're going to have some distractions. So that sounds like a technique you utilized for your time. Is that correct?
Exactly. Yeah. You learn the hard way. I know exactly the page that's torn out. That those kind of things stick with you. So I learned to, little techniques. Like it was when I transitioned from my BlackBerry to, my iPhone, it was hard to let go of my BlackBerry, but I got the iPhone and I got, almost all of my, articles and things that I needed to read and textbooks. I could take pictures of them and read on my phone or have a PDF form. In between cases, you learn to read. You learn to do questions. When you have downtime. Before I got home, I would stop by either a Barnes or Noble or Starbucks and read for about 20, 30 minutes. So you learn techniques to make sure that your work and your studies get done. So that you can have a quality time at home. Sure.
So that kind of leads us to another topic, and basically the main thing we're going to discuss today. Actually, before we move on to that, though, I do want to ask you, because this was brought up in another episode, something called a finishing or ending ritual, or way that you end your workday before you transition to kind of your life at home. Do you have a ritual or a way that you kind of shut off and go into your day at home, or would you say that it's pretty seamless?
Well, right now, my days are usually 24-hour straight calls, and the next day when I get home, everybody kind of leaves and I sleep and catch up and whatnot. But the way that I used to end residency was two of my colleagues and I would get off work and meet up at a place, either go over the cases for the day or whatever we were studying for our test or whatnot, and that was to end the day, to say, okay, at least you've accomplished something, and then you go home guilt free. The days that, there are busy days, of course, we took a break, but, the days that we studied, felt like, you've at least accomplished something. And when you go home, it's that much more, comforting to know that you can enjoy, time with family, knowing that you've accomplished most of what you needed to accomplish for the day.
Right. So what you're saying is, for you, the reflection at the end, to look back and see kind of what you got done, what you learned, areas of improvement,
right,
things that maybe didn't get finished, but that reflection was very valuable and helped your mind kind of turn off from the process.
Exactly. Yep.
I love it. That's great. And I think that's really important, because often, I think that's the way we get meaning, from the day, or what we're doing is that reflection piece. And if we're not able to do that every day, that's very powerful.
Mm-hmm.
So I appreciate that, because even I'm thinking in my own life, I don't know if I do that every day, but that would be extremely useful to actually see what did.
Yeah, I mean, I
Mhm.
exactly. Yeah, I didn't start doing that until halfway through my training. I think the first year you're basically trying to not sink, um, and
Yeah.
just survive. So I think there's steep learning curve of learning the systems, learning what's expected of you. It's really hard during the first year, year and a half to do that. And I started doing that about halfway through my second year, and really started focusing on that during my third year, when you become more of a senior and you start managing services. So I think when you get to a position where you've established the basics and what's required of you, then you kind of stand back, and at times you are the leader of the team. You're the most senior resident on a particular service, and it gives you that mindset of leadership. So
Yeah.
that's when you look back and look at the overall picture and say, okay, what do I take from this case? What do I take from this complication? So I think it comes with time. It's not something that that every intern is required to do, or should be doing. I think it's something that comes with time and experience.
Yeah, definitely. But I not only that, but I would also say there's a utility in kind of that reflection that we're talking about, because it is in a way a ritual of turning off. Because if you went to work, finished, didn't reflect, and then you go to bed, and then your mind is spinning about maybe this thing that you missed, or that you wish you had discussed, it actually might get in the way of you being able to turn off at home. So, even as a technique, it's valuable.
It's very valuable, and actually, you just reminded me. That's actually one of the things that I realized that changed when I started having kids.
Mm,
So the only time we didn't have kids was my intern year. I think halfway through my intern year. And I would come home and obsess to my husband about, things that had happened, a complication, or, something I was called out for, or, I would, beat myself up and say, I should have known that. I should have known better. And I would keep obsessing about it. After I started having kids, you know, it changed.
yeah.
Whatever issue that I had to deal with, I would obsess about it at work and, discuss it with, fellow colleagues, and or even when I got home, I talked to my husband about it for 2 seconds, and then I would quickly switch modes to I kind of tried to compartmentalize a little bit more. So having other responsibilities helped me with that transition. I
Wow.
I obsessed about it less.
Mm,
I dealt with it. I said, what do I learn? I started looking at it in the through the eyes of, okay, this happened. What do I learn from it? This is what I learned from it. And then I moved on.
yeah. Wow. I love that. So it really just helped focus you on what matters, and kind of taking away what you need to take away, and not like you said, obsessing with. That's fantastic. I just find that fascinating that
Exactly.
you actually having more responsibilities in a way helped you focus on what matters. I guess in a way that makes sense, but I just find that it's initially very counterintuitive.
It's very counterintuitive. And at first, it didn't make any sense to me. You're just, in the weeds and you're trying to get stuff done. But, when at the end, when you look back at all these experiences and you analyze all the things that you've done, which is basically what I've been doing, the past few years, is that's exactly what happened. It didn't make any sense to me at the time. I just had to keep going. And with everybody asking me, how did you do it? What's going on? How did this happen? My initial answer was, I don't know. But
Yeah.
in hindsight and analyzing all these things, that's exactly what happened. All these counterintuitive things, all these things that we're told that it's impossible, these things don't go together, and you can't put all these things on, on your plate all at once, and without something having to let go. I'm like, you know what? When you do that, you learn what's important.
Yeah.
And you start filtering things out, things that are not important, that just most of the time, take up your time, that in the end really won't have much of an effect on your overall outcome or whatnot. All that stuff gets weeded out.
Yeah. So that's wonderful. And so I think this is a perfect time for us to kind of go into our conversation for work life integration. And as opposed to necessarily work life balance, do you want to kind of discuss the distinctions a little bit between that, and we'll dive in how we can better find work life integration?
Yeah, I think work-life balance basically means you have a set amount of time you're working, and then whatever is left over, from your time, energy, and whatever else of yourself you have to give is what's devoted to your life. So if you're working many, many hours, you have very limited time devoted to actual life.
Right.
Do you agree?
Yes, definitely.
So work-life integration, the way I understand it, is the two can be blended. Right? We have, we can access everything through our, smart devices. Everything is connected. You can, access medical records and whatnot, from the comfort of your own home. Schedules are a little bit more flexible now with, people actually taking work-life, work-life integration balance, whatever terminology they use at the time, into consideration. A lot of people are looking for jobs, asking for those things.
Yeah.
Right. So I think you're able to integrate both to where, if you're at work and you have downtime, you can, still have time to take care of things that you need to take care of regarding your personal life. It's not, you don't, before we used to think of it as compartmentalizing things. You deal with life outside of work. Don't bring your life to work with you. To a certain degree, I agree with that sentiment, as far as, problems and emotions and whatnot are concerned. But, who's to keep you from, scheduling things or making calls or, doing things that you need to do, if when you have downtime at work. And then on the other hand, when you are home, and things are required of you from, a work standpoint, you can handle those things from the comfort of your own home as well. You don't have to go into the hospital every single time.
Right. And as we're talking about this, there's so many opportunities to think about the way we use now that it's 2018, we have all these digital tools. There's so many ways that we can still do things at the home or get tasks done when you have those gaps in time. Right. And just as an example from my end, I've had a few people ask me how I'm starting to do more daily content for the podcast. And I said, well, when I'm on call and I have, 30-minute gaps where nothing's really happening, I just pull out my laptop and start recording, and that's like a simple example. But for, someone who's a parent and needs to get grocery shopping, there's multiple grocery shopping applications that let you grocery shop even though you're not physically at the home, and you can order food, for example. So those gaps in time can be extremely valuable. What examples do you have in your own life of something like that?
Well, one of the things I do, I have a pretty nice schedule. I plan things ahead of time. Mm-hmm. Right. So I'll have chunks of I'll take all my calls kind of, put together. And so I have chunks of time where I'm home and I can take care of most of those things. When I'm at work, and, sometimes Tom is a hit or miss, right? You're either very, very busy or not busy at all. So those days, my articles that I've published get written during those times. Doctor's appointments get scheduled those times. Bills get paid during those times. Recently I started, writing a lot more, and so that's the time that I don't have the time when I'm at home to sit down and write, except for, when the kids go to bed at night. But when I'm at work and I know I'm going to have, potential downtime for multiple days in a row, that's the time that I sit down and say, this is when I do, these things that I have planned.
Yeah. So that's another part of the work-life integration concept is, you're going to be working consistently. Like, do you, like, just out of curiosity, how is your schedule set up? Do you work like specific sets of days in a row, and then do you have a few days off here and there, or is it not so rigid in its organization?
So no, it's not. It's not very rigid. It's pretty flexible. We have a wonderful group of surgeons that in our group, and we're all family oriented, and that's one of the things I loved about the program when I interviewed here.
Mm-hmm.
And so we all have responsibilities for a certain number of calls, and so a certain number of days that you're on, and certain that you're on call at the hospital for 24 hours, and another set that you're on call for as backup, which means you just have to be within 30 minutes of the hospital. Right. So what I do is try and put those all those calls together so that I'm working, 2 weeks out of the month. And then the other 2 weeks I try and take off as much as I can.
Yeah.
So there's, administrative things that I have to do, but those 2 weeks I try and not, I'm not on call. So sometimes, we have people who request time off. So there are, months where I'm on call every week, 2 days here, 3 days here, 1 day there. But most of the time, our practice manager does a pretty good job of getting everybody what they want. And so I'll work really, really hard for 2 weeks.
Yeah.
And the other 2 weeks I'm home with the kids.
Yeah. Yeah. And you and I might be similar in this. When I'm personally in work mode, I'm in work mode. And, there's a really great book that I read. I can't remember the exact statistic, but basically when people task switch, it's more so when you're multitasking, but if people task switch too much, you lose a lot of your efficiency. So, for example, if you go from one task to another, and then you go back, I think it was like 27% of your efficiency is lost. The number doesn't matter, but for me, it translates into work mode and then like relaxed mode. And I have a kind of a difficult time turning myself off, when I am in work mode. So I appreciate like what you're saying is you like to stack your schedule into working times and then relaxing and spending time with family, instead of having it really interspersed, which I think is a pretty valuable technique.
Yeah, I mean, it's worked out great for us because what I can do during those times is I plan ahead. The weeks that I know, we have a big family calendar, and everybody puts all their stuff on there. We have the visual one that we have, in our kitchen, and then on the computer and on the phone, like we all have, Apple devices, and so everybody, like my kids, even can see my schedule on their computer. Oh, so wow. They know ahead of time. Yeah, they know ahead of time that I have chunks of call schedule coming up. Right. So we get things done ahead of time. We make sure that before my streak of calls, comes on, that, all the stuff in the house, everything that they need for me is done, all the, wherever they need to go, we make sure we go, do our library runs and get all their clothes ready and, get everything that they need. And I'll cook, a whole bunch of food and stuff the fridge. And so that week that I'm working, they're all self-sufficient. And if they run out of whatever they need, they know they're on their own. Yeah. So it helps us plan things ahead of time. And I got to figure out, I got to get that book from you because I truly believe in that. I say, I like multitasking, and I like multitasking in certain things. But when it comes to, task switching from big things like being on a 24-hour call and having to come in and, be on, mommy mode, that's, it takes a toll on your body. Yeah. And on your psyche. So that's why I really, I've tried different things when I first started working, but this, chunks of blocks of, call and, mommy time have really been the best for us.
Yeah, yeah. And the book that's coming to mind, I think it is from this book. It's called The One Thing by Gary Keller, and it is a fantastic book on time management. And it's funny because you're actually utilizing a lot of the techniques that he mentions, but it's for you, it's more intuitive. But yeah, so one of them is task switching. The other thing that he talks about is chunking or blocking out times of work. Simply because when your brain is in work mode and you're focused and you're thinking about your patient care and you're thinking about that patient's vitals and the medications, this and that, and all of the procedures you're about to do, it's very hard to do that. And then all of a sudden switching over to empathetic, family time, relaxed mode, thinking about, your kids and, but if you're able to, like you said, chunk it out, and you have work mode and then parent mode, it's much easier. And, you're the other piece of this conversation I wanted to bring up is, now that you're an attending, obviously you have made conscious decisions and choices about how you'd like to organize your schedule and what program you're working at. What are some pieces of advice, when you're thinking about your schedule? What are some things that you think people should look out for when they're deciding where to work or decision making in terms of timing? Because again, you're under some extreme constraints.
Right. So, so one of the things I learned when I throughout my job seeking experience is I had one awful experience where when I was interviewing for a general surgery job before I decided, I was going to do a fellowship and pursue trauma, I learned the importance of knowing what your values are. Okay. And in this interview, it was basically completely one-sided, and they told me everything they expected of me. And when it came to time for me to, interview them, because when we're interviewing for medical school and residency, we're kind of, seeking to be accepted.
Yeah.
Right. But when you're done and you're out there and interviewing for a job, you're also bringing something to the table as, as an attending. So in this interview, basically this is what we expect. And if these expectations are not met, then things will not end well for you here in the middle of an interview.
Wow.
Okay. So, yeah, so I left that interview thinking, okay, and the schedule was going to be pretty grueling as well. And so it kind of made me rethink, what I really wanted and what I really valued. And it made me realize that we completely had different value systems. So what they were looking for and what I wanted were completely different. So I decided to, do a fellowship and, look for a trauma position. And when it came to, interviewing for my ultimate, trauma job, I felt empowered to ask, about the schedule, see a sample schedule, to inform them that, yes, I have kids, and yes, family time is important to me. And I felt confident in, turning down a job simply because they weren't on the same page as I was.
Yeah. Yeah.
Yeah. I think it's very important to know that, number one, you are bringing something to the table. When you finish training, residency, fellowship, whatever, you're bringing something to the table, and that you should be asking and expressing things that are important to you. And especially if time is important to you. I remember getting a contract without knowing what the schedule was. And I said, I'm not signing this contract until I see a sample schedule. And when I saw the sample schedule, I was working harder than a resident.
Yeah. Yeah.
So I think that's a very important thing to know, is before you sign anything, make sure you at least see what lifestyle is going to be like, and don't be afraid to ask about lifestyle. I think that's one of the things that we still and issues that we have with the medical workforce, is that asking and being concerned about work-life balance is not as welcome as we would like it to be.
Right. And, follow-up question, I'm not in the surgical world. So is that still, do you feel like it is taboo to approach these interviews, thinking, I am valuable, I do bring something to the table, and that, I need to be asking these work-life balance questions and what does the schedule, do you feel like some programs might be turned off for you being almost, even though to me it seems like a very obvious thing to ask, do you feel like some people are like, oh, she's or he's too entitled? Like, do you feel like that happens in the surgical world?
Sadly, that word entitlement is applied to, all young physicians these days, the millennial generation of, feeling entitled and whatnot. But yes, I think I believe it still remains taboo because, just 3 years ago, it's almost becoming common practice for most schedules to be, week on, week off, whether it's from, medicine, the hospitalists doing that, so some surgicalist services doing that, going from the one person, taking care of, their patient the whole time during their hospitalization. It's turning into the team approach. The entire team takes care of, the service. So when you're off, you're truly off, and you don't, we still obsess and call about our patients and check on our patients, that we admitted or operated on or whatnot. It's becoming more and more of the team, providing team-based care instead of an individual-based care. Yeah. So I think it's still taboo depending on where you go, especially if you go to big, academic centers. You're expected to be, the triple threat of, being productive academically and, being there, all the time. And the week on, week off is considered more of a private practice kind of. Gotcha. Actually, I shouldn't even say private practice either, because a lot of private practice physicians and surgeons work, nonstop. Yeah. So I think it's more of a hospital employed model. Okay. That does that. But I think yes, it is taboo in certain places, but I think unless you ask for it, you don't know what you're getting into. Sure. You may not know what what situation you're going to get yourself into. Sure.
And yet, I'm sure you would still recommend asking all of those important questions before you sign that dotted line, because you obviously want to know what you're getting yourself into. Because obviously, it sounded like you went into a situation where you didn't ask those questions, or did you not actually sign when you went to that interview?
No, I didn't sign anything. So that interview I brought up because, the importance of knowing what your values are when you're, right. When you're in an interview. So that interview, the first one that I talked about, they didn't even let me get past, the one-sided interview. Gotcha. When it came time for me to ask the questions of, okay, what's my schedule going to be like? Or it showed me that, basically it was my resume was thrown across the table, and I was told I had accomplished nothing for the past 5 years. Yeah. After I had, three kids and, a few publications in addition to all the work that I was doing, basically because I wasn't more productive academically. My CV was thrown across the table, and I was told you accomplished nothing for the past 5 years.
Wow. That's crazy. Oh my gosh. So yeah, that's totally nuts. But that, yeah.
But that, no, I just wanted to say, but that situation taught me that, your value systems aren't always going to align with the person that's, looking to hire you. So right. I think knowing, what they value, and if it aligns with what your values are, is very important.
I love that. I love that tip. And I think being cognizant of that going into it beforehand is going to be really helpful for you to know. It's just like a relationship, what are you looking for in your right. partner? What do they actually offer? And is there discrepancy, or does this look like a partnership that you'd like? And that makes total sense. To shift the conversation, a little bit, we've kind of mentioned some things about work-life integration. I'd like us to, close in on a few things that we've hit on in this conversation in terms of work-life integration as opposed to work-life balance. So I'm going to try to summarize it, and then I'd love for you to add on a little bit more to this list or to these thoughts, just so the listeners can make sure that we've provided them a good idea of what work-life integration is and how they can utilize it. So work-life balance, in summary, is more so, you work 8 hours here, you get 16 hours off, or you work 12 hours here, you get 12 hours off, and you have work, and then you have life, and you try to find that balance consistently, whereas work-life integration doesn't necessarily need to look like that. You can actually accomplish things in your personal life while at work when you have free open spaces of time, or you just chunk everything together and you work X amount of time and then you go into life and personal stuff. And Dr. Qaali had also offered that you need to make sure you have deep planning so you can make sure that you cover everything. You can accomplish things at work and stuff in your personal life, but it doesn't have to happen in a, quote, balanced way. And then what other additional thoughts do you have in terms of that?
Yeah. No, I think you hit the nail on the head. And this is, I think, important, especially for those in training. We've previously been programmed to think, that everything, right? You have to put off life until until you get your degree, until you get your you finish medical school, until you finish residency, then you can start life. But it doesn't have to be that. All right, you can learn to have a good balance early on if you practice these skills, right? If you practice these skills early on, it's going to translate into you being a more satisfied physician later on. Right. You don't have to wait until you're done with residency, to figure out that, yes, I wanted to have kids all these years, or yes, I wanted to travel, or yes, I wanted, to pursue, this field. Like, look at what you're doing. You had questions, you had concerns about, what was going on with, our healthcare workforce and why everybody, was being burnt out. And you turned your questions and your passions into a podcast.
Yeah.
Right.
Definitely.
And so you didn't wait until you finished training. You didn't wait until you finished your training to figure this out. You found a way to integrate it and to, pursue these questions. So I think that's the important thing, is that if you start having questions, or you start thinking, this is something that I want to accomplish, don't let work get in the way. It's, we look at work and say, okay, this is what, I have to finish this before I can do that. And I think that's where the whole work-life balance was so limiting, is, you don't have to wait until you finish residency. There are things that you can accomplish while you're still in training. Right.
And I love this conversation. And just to add on, a little bit, from my end, because I'm a big fan of creativity, innovation, taking your life to a new level of experience, and we talk about this a lot in the podcast, is one of my friends, Sunil, actually had mentioned this concept, and I think it's really helpful in this conversation. A lot of people think about free time, time slots. They just have ample amounts of free time, and then they'll start to accomplish something, as opposed to when you want to accomplish something big, it actually happens in chunks or events. And we kind of alluded to this, but if you want to, for example, create a podcast, or you want to finish a book, or you're trying to create this article or publish something, or whatever your aspirations are, if you plan it out and you separate it into chunks, like specific events that need to occur, then every time you have that 5-minute, 10-minute, 20-minute slice of time, you can start to chip away at that big mountain or thing you're trying to accomplish with those spaces of time at work. And that's, again, another way of work-life integration. And that could be, again, like you're saying, with your family, doing a task that would be helpful for your family while you're at work, or like you said, you're publishing an article, you can just chip away. And that's really, I think, what work-life integration really is.
Exactly.
Boom. Love it. So, Dr. Qaali Hussein, again, it's absolutely a pleasure to have you. I want everyone to please not only listen to this podcast episode, of course, if you've remained with us, but she has an amazing episode previously that we recorded. It's called Breaking All the Stereotypes, Supermom and Trauma Surgeon Dr. Qaali Hussein. You can look her up online as well. She's written several articles talking about her story. And again, she was our most popular episode, most popular on YouTube for us. And there's good reason for that. Her story is amazing. I want everyone to be familiar with it. Dr. Qaali Hussein, do you have anything to add before we close out this episode?
No, I think you covered everything pretty well. Thank you so much for having me on the podcast again. And I'm always happy to collaborate and figure out how we can improve the lives of physicians and our young trainees, so that they can truly be happy docs.
Absolutely, I love it. And again, to me, surgery is probably one of the toughest in terms of what I think about lifestyle. So it's great to have someone who's general surgery trained and also has the trauma surgery experience to offer, your wisdom, in this realm. So I really appreciate your time.
Thank you. Thank you so much for having me, Taylor.
All right. And take care. Thank you so much for listening to the Happy Doc podcast, the voice of fulfilled physicians. If you enjoyed the episode, please drop us a like, comment, and share. Share us through the social media channels we have on Facebook, Twitter, and Instagram. The handle is @HappyDocPodcast. That's @HappyDocPodcast. You can find our website at www.thehappydoc.com. Again, thank you so much for listening to the Happy Doc, the voice of fulfilled physicians.